Hey there, welcome to the next Judo Waza Podcast. I have here Dr. Anthony Catanese, and we always refer to him as the Judo Doctor. So I'm here to interview him about some things that are interesting to me. So Dr. Catanese, welcome to the Judo Waza Podcast. How did you get started with Judo?
Well, I actually started Judo with Hank Kraft in Queens, New York, around 1963 or 1964. I was 7 years old. And I remember that the first tournament I played in was about a year later, and we had a club tournament right after the '64 Olympics. Wow. And so I've been in judo a real long time. I've been in the same Udanshikai in New York, and many of the old timers I knew when they were young guys.
Awesome. Why did you go to medical school? How did you pick that as your profession?
Okay, that's a judo related story, and. In my class at Hank's Queens Judo Center was Arthur Canario. Some of you guys know Arthur. Arthur was the 71 heavyweight national champion, and he's also been a world masters champion, and he was a tremendous player. He had a left Tayatoshi that could plaster you into the mat, and he was in my class. He was 6 or 7 years older than me, and one day he decided he was going to go to medical school, and I saw how much mileage he got out of it. People were impressed that he was a great judo player, but they were much more impressed that he was going to go to medical school. And I realized I would really like to go to medical school, but the problem was I wasn't a great student. And when I told my high school guidance counselor I wanted to go to medical school, he basically laughed at me. He thought it was an impossibility. And I went to my sensei, who many people have these very special relationships with their sensei. And I said, I want to go to medical school, but they told me I was too stupid. And he said to me, you're my athlete, I've trained you for years, and I'm convinced you can do anything you put your mind to. I know you can go to medical school. And what actually happened is my judo class helped me go to medical school. The way they helped me was they got me a job as an instructor, because to go to college, I had to get a job, pay my own tuition, commute on the subway, and I had to, survive by myself. And so what they were able to do was get me a job teaching kids classes later in the afternoon, and I was able to earn enough money to pay my tuition. Back in those days, tuition cost nothing, particularly in New York City, and I was able to actually get into 4 American medical schools. It was fairly amazing. I didn't think I could in the beginning, but I was able to do it and was very successful at it.
Dr. Canario.
Dr. Canario, yeah.
He's the first orthopedic doctor to look at my knee when I got hurt.
Oh, yeah.
And it was right off the mat at the New York Open. Yeah. Right, Yanni was with me, and I had won the first round. It was the only time I gotten past the first round at the New York Open. Yeah. When it was a regular tournament, right? And what happened was I got a fully pwn, and as I stood up, my left knee gave out, and he came on the mat to check my knee, and so he's a very, very awesome, very good orthopedic.
Right, he's at the New York Athletic Club.
Yeah. You have traveled the world for being the team doctor with USA Judo. Can you share some of that experience?
Sure. So I started off originally as being a local tournament doctor, and I should tell you that story. That's a good story. I was in my 40s, and I was a physician, and I was still playing judo, still competing, and I was competing in seniors as well as masters. Don't ask me why. And I was also refereeing, and Rusty Kanakogi was our head referee, and we had an older guy who used to be our doctor. It was Dr. Rothberg. He was a cardiologist, and Dr. Rothberg decided he was too old to work anymore, and he wanted to retire. And one day, Rusty came to me and said, you're going to be the new doctor. She said to me, you're a doctor, right? I said, yeah. She said, you're going to be the new doctor. You're not a referee anymore. You're not that good at being a referee anyway.
She told you.
Yeah, she told me.
She didn't ask you, she told you.
And the next tournament, Dr. Rothberg was showing me what to do, and I got about 10 minutes of instruction. That's something that's a saying we have in medicine, which is very similar to judo, and it's see one, do one, teach one. So I got about 10 minutes of instruction from Dr. Rothberg, and immediately I was the tournament physician. And I was the tournament physician a dozen or even 15 times a year, and I've done that for over 25 years. But I knew that there was another role that a doctor could play, and that was team physician. Team physician is the doctor who travels with the team. And I knew from sports medicine conferences, and I knew from talking to other people that it existed, but we didn't do it a lot in the United States because they didn't really have the funding. And I had written the first edition of my book, but I wanted to be a team doctor, so I actually asked Chris Scully if he could introduce me. He was manager of the national team at the time, and I asked him if he could make some introductions, and he introduced me some of the people at USA Judo, and they were more than happy to have me as a team doctor. They were they were very accepting, and they got me started, and so I started traveling with the World Junior team, and I've been to about a dozen different tournaments, mostly World Championships and some cadet, and I learned quite a bit about sports medicine, how it's practiced in the world, how it's practiced in other countries. But one of the things I really learned about was judo in other countries, how much money they put into it, and what their training is like, and the resources they have. And I realized how difficult it is for us to compete with them.
How all the other teams that travel around the world on the circuit, whether it be junior or senior, do they also travel with a doctor as well?
Yeah, so all of the big teams in the world have a doctor, and in fact, some of the teams, I'm thinking of Japan and I'm thinking of Russia, they have a male and female team doctor. So they have a woman doctor for the female team and a male doctor for the male team. And I would say at a world championship, if there were 30 or 40 countries, 15 of them might have a doctor. The smaller countries don't, but there's another thing that they have which is interesting. Cuba loans its medical services to a lot of South America and a lot of other countries. So what you'll have at a world championship is you'll have a couple of Cuban doctors, and they're supplying services to all of South America, particularly a country like Venezuela.
Close ties.
Close ties. But they'll often have no equipment. So another thing I learned is that I'll have a very generous bag of equipment. I'll bring lots of bandages and whatever we should need in case we really need something. And as soon as those other doctors were aware of that, they would try to get the equipment from me. They would say, can I borrow some tape? Can I borrow some liniment? What they love in other countries are things that you rub in your muscles, which we don't really use much in the United States. So it's been a very interesting experience.
I know from past work experiences that Cuba, with regards to education, especially in the medical field, their knowledge, they're very advanced. Right. They're very advanced.
They're superbly educated doctors. They are highly trained, and they know about everything, but they have no equipment or supplies. Like so it's very common in Cuba for somebody to have an excellent diagnosis, a great doctor, but they can't get the medicine, so they die. Wow. But that's another political talk.
I also know that the team has the Cuban team has massage therapists and psychologists that work with them. I've heard that, so that's amazing.
We have in our Olympic Training Center, we have just about every service available to physicians. But one of the problems with the United States, it's such a large country that we're spread out all over the place, and we just don't have the same resources. And when you get to one of these world championships, you really see what you're up against. You're up against kids who live in a judo training camp, train every day. Every weekend they go to a different country to play in an international tournament because it's only a train ride, and their conditioning and their experience is no comparison to ours. Our athletes some of them may be better, may be more gifted, but they start at a great disadvantage.
Interesting. You've already written a book for medical care of the judoka. How did you come about writing it? Like, what was your inspiration to write it?
Yeah, so when I was working as the tournament physician in New York, I started to give lectures to the referees. My typical way of working would be I'd get to the tournament early, I'd meet up with the referees, I'd go to the referee meeting, and then they started to ask me, could I give a lecture on concussions? Could I give a lecture on chokes? And I realized it was very easy to give a lecture because it was something I dealt with all the time. So I started to give the lectures, and then after a little while they said, could you write up some of these lectures? Could you actually type them up so we could refer to them later? So what we did is we got a little tape recorder and I taped the lecture, and then I had someone transcribe the lecture, and then I distributed it. And at the end of a couple of years period, I actually had 20 lectures. I had 20 different topics, and I realized, I have enough material to actually write a book. And it was suggested to me that I write a book, but getting back to the medical school stuff, I was never considered a strong reader or a strong writer. I was always someone who had, a little bit of a learning disability. And I remember I told my daughter that I was writing a judo book, and when she was in college, and she looked at me and she said, "That's ridiculous. You can't even read. How could you write a book?"
And you're already a doctor.
Yeah, no, well, being a doctor is something else, but it's. But I was able to take the book and many people ask me, if I'm not a strong reader writer, how did I write a book? It's a 350-page, 80,000 word book, and the way I did it is in medicine you speak a lot and you transcribe. So I have a scribe at work. I don't write in charts. I have it's in my phone now. I'm just able to speak into the phone, and somebody transcribes whatever I said, and the next day it's printed out and it's in the chart or it's wherever it needs to be. So what I did is I actually dictated the entire book, and then I went through it and looked for errors or mistakes or things I wanted to change, and then I dictated it again. So I went through about 6 or 7 dictations of the book until I got a finished product. And then a lot of guys in judo helped me proofread it. About 6 or 7 guys actually edited it. They went through it and they looked for big mistakes or problems. We never had to worry about little mistakes because the publisher proofread and edited the book. So if they didn't like a sentence, they changed it, and they let me okay it, and I said fine. But at the end of about a year's period, we had a book.
Wow, that's amazing.
Yeah.
How difficult is it dealing with a publisher when you have a subject that you're passionate that you want to write about? Just in the book writing process alone. So
I was very fortunate. I found a publisher that does educational books. They've done other sports medicine related books, and they just believed in me. They believed the book is a super book, and they actually they believe that with a little advertising you could actually make some money. What happens with books is they tend not to make a lot of money because. So what we did is we priced the book very inexpensive so that it would be widely distributed, and we also put it on Kindle, and so we made the book very available to people. So we didn't make a huge amount of money on the book, but I was at a world championship a year or two after the book came out, and there was one of the South American doctors, and he had my book printed off the internet and bound with paper clips, and he was referring to the book, and I said, "What's that?" And he said, "Oh, it's this great judo book by some guy in the United States." And I said, "Really?" So I realized that the book has been pirated, and it's probably you could probably find it in different languages. Who knows?
That's a great story.
It's very hard to protect copyright in other countries.
Sure. But the notoriety that you get from being an author, putting together, the material to write a book and getting it published is just, it's...
You get a lot of notoriety, and I get a lot of notoriety in the sports medicine community, and particularly in the judo sports medicine community. They find me they find the book fascinating, but they don't always equate that it's me who wrote it. They can't quite figure out, that I actually wrote the book.
Wow. I know that you're working on the 2nd edition of your book, and I know that there's new chapters in it, some that might be controversial,
right.
And I wanted to give you an opportunity to talk about it.
So in the first edition of the book, we have 20 chapters. It's very straightforward. Then there may be a section on arm injuries and leg injuries and very normal stuff. In the 10 years or the 9 years that transpired between the first and the 2nd edition, all sorts of things came into sports medicine that became important. A lot of them very politically charged. So, for instance, we expanded the section on concussions, and that's the CDC's Heads Up training course, and it's a very important subject. So even though the section on concussions isn't that different than what it was 9 years ago, concussions have become very important. They've realized that people get brain injuries from doing sports. that it results in degenerative neurologic disease like Parkinson's disease, ALS, but it also results in depression. And so we expanded the section on head trauma, and some of that is, is politically based. We came up with an extended section on Judo Waza, over 30 pages, and part of it is because of the problem with police chokeholds and what's been going on. And the second edition was written prior to our recent incidents with a recent incident in Minneapolis. But so we explored the whole concept of police chokeholds. Are they the same thing as Judo Waza? Are they safe? Should they be taught? And it's not meant to form an opinion or a political opinion, because I don't know the answer, but it's meant to be a resource for someone who wants to research it. And it's it's a fascinating subject. So if I could I talk a little bit about police chokeholds?
I want you to get into detail about it.
Okay.
Because when you talk about, like, let's say Eric Garner, I don't know I don't remember the video, but I don't know that the police officer, and I mean, I have respect for all life, right? And again, I don't want to get into politics either, but I don't know that it was a full choke. It might be just that he had kind of had pressure on the chest, and not that he was securing, a full choke. And so poor guy was already out of shape, had a bunch of, health issues already. But I'd love to.
So we never talked about this before, but you understand that's exactly what the issue is. So the Eric Garner is the one in New York about 2 years ago, and the accusation is that he got him in Hidaka and he strangled him to death. And if he was taking a yellow belt test for Hidaka, he failed. He would have failed. And,
it wasn't a good
so there's actually a landmark article on police chokeholds. And it's by Dr. Kawai. Dr. Kawai was president of the USJF in the late 1970s, and he was a forensic pathologist, and he actually did a study. So the problem with police chokeholds is going back 50 years, and he actually studied it, and he looked at 14 cases of chokeholds that resulted in a fatality. 13 were police officers, and 1 was in some other martial art. And he found the following things. He found that usually the person was intoxicated. Usually the person was a middle-aged, overweight male.
Wow.
Usually the person was on their face or unable to breathe, and this is what resulted in it. Yeah. And then he came out and he said that judo chokeholds don't result in death, or judo shimiwaza in the dojo or in the tournament almost never results. In fact, since the Kodokan started collecting data in 1882, there are no reported shimiwaza deaths in supervised judo.
Wow. Well, it's getting completely ignored now.
Yeah, and the reason he said it is because there's supervision, be it the instructor or be it the referee, that the person who's doing it is skilled at doing it. The person who's having it done to them is skilled at doing it, so they know to submit. Things that can happen in a police altercation situation. They know to submit, they're familiar with it, they know to tuck their chin in. The individual who's performing the shimiwaza knows not to do it across the trachea. It's not that doing it across the trachea is wrong, but if it's in a tournament, the guy's going to submit immediately, or the referee is going to stop it immediately. And the amount of force that is used, you don't need extreme force if you get the carotid artery or the carotid body, which will result in lowering the blood pressure. You have to get in the angle du jour. So Dr. Kawai said that this is the reason why shimiwaza is safe. Now the question is, can you translate that to police chokeholds? And the argument that some people have made is that and they use Japan as an example. In Japan, every police officer is an active member of a judo or an aikido club, and they're practicing their chokeholds regularly with their sensei watching, with supervision. And the question, and in fact, failure to practice and work out will result in loss of your job. And there are countries like that. And remember the story, everyone hears the story when they're a kid.
That should be here in the United States, because the one thing that they lack after they graduate the police academy, it's a conversation I'm going to have with another friend, is the lack of training when it comes to pain compliance and that physical confrontation.
So people have thought that you need a 2-week refresher in the police academy every year, or that you need to have a regular number of attendances. You need to have 30 attendances in a martial arts class a year, and in some situations, so there's a belief. There are people who believe that chokeholds are actually safe if they're done correctly. Now, we just take a second without getting political. It is not safe to kneel on someone's neck for 6 minutes. No. That's called homicide. Okay, so we're not talking about that.
Absolutely.
And that's a bigger problem. And it's very easy to deal with the medical problems and the physical problems, but it's very hard to deal with the social problems. And I'm not going to get into that. But you were asking me about some stuff that's in the second edition of the book.
Yes.
And so important was concussion, important was police chokeholds, and then another area is abuse, abuse of the athlete, and when we had come out with the first edition of the book, Kayla Harrison had not come out with her book yet, and no one really knew much of the story, and one of the questions that people always ask me, how common is this stuff? How common are pedophiles, and how common? And I will tell a very brief story without details for the purpose of it. But when I was 16 years old, I went to a nationals from New York, and it was actually in San Francisco. And the New York team went with a convicted pedophile as our coach.
Yeah.
And
no one knew.
There were many details. I always tell people if you want to talk more about it, they can always talk to me in person or call me or talk to me at a tournament. But he molested one of the younger kids, and this younger kid went on to have a very troubled life. And the kid was national champion, a senior national champion. So there's a lot to this pedophile thing, and so we approach that a little more. We get deeper into that, but the part of the book that everyone's asking about is, and again, we had to politically be progressive and add things into the book. So we actually added a 37-page section on transgendered athletes. And
is that something that our governing bodies are requesting information on, and especially when it comes to guidance? I'm assuming that they are requesting.
So what happens is in sports in the United States Olympic Committee makes recommendations, and they tell the different USA sports divisions to come up with a policy or fix it or do something. So within the last 4 years, the USOC has recommended that every sport have a transgendered policy, and details of it are unclear. They just often start off by saying just go and do it, and a couple of sports have done it, but most of them haven't. And judo, it's been spoken to about judo. They've also spoken to, if you understand the structure of judo, the USJA and the USJF, although they're not USA Judo, they're not the ones that run the Olympics. They're independent bodies, what they call Group A bodies, whatever. So they were asked also to look into transgender athletes, and they have been working on a policy, but there's nothing printed yet. The closest thing you can find to a transgendered policy in judo is Judo Canada. Judo Canada has come out with a policy.
Really?
Yeah, very progressive. It came out in 2017.
Okay.
But it doesn't have a lot of details. So what we thought we would do is, we thought we would tackle the subject and get information on it so that it could be used as a reference for somebody's future policy. And we tackled it mostly from a medical point of view because the social is overwhelming.
Yeah. The
social is overwhelming, but it's if I was going to give you a lecture on it, it would take about 3 hours just to go through the lecture. And we go through what a transgendered individual is, and we also go through disorders of sexual development. So there are actually two separate things going on. Transgenderism is the situation where an individual changes their sex to the other sex, and disorders of sexual development is a situation where someone is born with a intersex or a mixed sex issue.
So I have a question in there.
Yes.
Let me.
Okay.
The question there is that, are you considered a transgender not until after a surgical procedure?
So, yeah.
Is that correct?
Well, yeah.
Not
so
that I
it's-
wanted to throw you a curveball.
It's a changing topic. So in the United States, which is a Western country, very progressive, very liberal, very high on human rights, the way you decide you're transgendered currently is you make the statement that I'm the wrong sex, I want to be the opposite sex, and you maintain that statement for a year. You don't have to legally change your sex. You don't have to have sex change surgery.
Yeah.
If you're an athlete, you have to have hormone levels that are within a certain range,
Yeah.
but the range that they have is not the range that everybody agrees on. A disorder of sexual development is 1 in 2,000 births. There's about 60 different disorders, and in it are hermaphrodites, which are somebody who have both sexes, but those are really very rare in humans. Intersex, which are people that are half one sex and half the other, but you have a lot of people in there who have a hormone problem. So one of the problems you have are women who have high testosterone because of a genetic imbalance in their hormones, and the high testosterone is nothing they did. They didn't ask for it. They didn't pick it. But when they get tested, they fail.
Yeah.
And they tend to be very successful athletes. And the example is in track and field. Casta Seminar, who's a South African track star who is a phenomenal athlete, and she has one of them. We don't know which one because we're not her doctors, and it's not our business. But she has high testosterone, and they've done all sorts of legal stuff to her. They said she can play, she can't play. They put limits on what events she could be in.
Wow.
That she couldn't be in certain power events really,
Unfair.
or sprint events because she was too strong. But she could be in other events, and none of this stuff makes any sense. And that's what we're trying to struggle through. But we know, for instance, that whatever it is, be it a DSD or a transgenderism, if you have higher testosterone through puberty, even if you lower your testosterone, you're going to be a better athlete. You're going to have bigger bones, muscles, more cardiac, more pulmonary capacity. You're going to have your neurologic system wired differently. Males are more aggressive. Testosterone makes males more aggressive. So someone who was a male who went through puberty and then transitioned to a female, people have problems with it. And then what's happening in the United States now, which is not what we're getting into, is all of the medical, legal, social, moral issues. So currently we have the United States Educational Department suing Connecticut to stop transgendered athletes from getting scholarships in high school and getting high scholarships in college and playing high school sports. And they're saying it's a civil rights violation of the woman by allowing the transgender athlete to play. So it's full, it's a can of worms.
That's, you know what, when you see me with my mouth open, it's because I'm always like, when I hear like something that's way out of the norm, I got the born in the cave moment where my mouth drops. And you've traveled obviously with the national team all over the world. Do you see this as a problem now? Not a problem, but a challenge now for judo to face now, or do you think we've got 2, 5, 7 years before we have to worry about this on a social level for our sport?
I think it's going to take a while to come to a head. The problem is other countries don't accept any of this. There are countries where if someone's homosexual, they execute them. There are countries that have killed homosexual athletes because they've come out as being gay. Wow. So the United States is very progressive, and some Western European countries, but we're a long way off. There are 1.4 million transgendered individuals in the United States.
How many?
1.4 million.
Okay.
Million, which is an incredible number that no one would really know.
Wow, that's amazing.
And it's interesting too, because there's just as many female to male as there are male to female. We all think of the guy who becomes the girl.
Say that one more time.
Okay, so we all think of there are lots of words, you have to pick up a lot of vocabulary, but we all think it's male to female, MTF, but there are just as many FTM, female to male.
Really?
Yeah.
Okay.
And I know without talking about any details, we had an experience with someone who, a young woman who wanted to play
Yeah.
in the male division.
Correct.
And we didn't have any policy for it, and
Yeah.
some of the older guys in the Udan Shikai didn't think it would be a good idea because they were afraid you would kick their ass.
Yeah. Well, I mean, listen.
Which is probably true, but
I'm going to tell you this as a tournament director with zero guidance so far that I know of from, USA Judo, the USGF or the USGA. As a tournament director, the place where I lean on, I hate to say to avoid the subject, is that we don't have the guidance yet from the NGBs to know what to do.
right.
And so I think that kind of keeps us very very vanilla on the subject, very Switzerland.
Right.
But I don't know if tournament directors should be addressing this to the point where they're putting it on an application. I don't know what the answer is.
I think it's going to happen in the next couple of years. So what we did in the book is we wrote actually our own mock policy, specifically stating that no one endorses, it's not represented by anyone, but anyone should feel free to use it as a starting point. See, the problem is the information is so alien to most people that you have to learn a lot of vocabulary and you have to learn a lot of theory before you can discuss it. And a lot of the policies that I've seen are purely social. They ignore the medical part of the issue.
Yeah. It's totally social and political. I think. I would like to get back to anything else in the book that you want to talk about?
I think that's a good start. So there's 36, 37 chapters.
Okay. The first edition had how many chapters?
20.
And so now you increase it to 37.
Almost doubled.
When you look at your first edition compared to your second edition, in the first 27 chapters that you did, was there anything that you wanted to change because you thought you could have done a better job?
Yeah. So believe it or not, there's almost no facts that changed between the first and the second book, and but there's some things that we wanted to expand on, and but there's some that we still struggled with. Like, so for instance, one of the chapters was traditional Japanese first aid, which is Kappo, K-A-P-P-O, which if you were a kid, if you did judo in the 60s, when you became black belt, they taught you how to do CPR, Japanese style. Okay. And they had different kappos or katsus for different injuries, for resuscitating the unconscious athlete. I wanted to learn more and study about that, and I managed to get a lot of history, but I can't get a lot of instruction on it. And it's not that it's not done. And all of us have seen some of our old senseis set a bone or reduce an elbow or reduce a shoulder, and it's something a doctor is told never to do, or get an x-ray first or send him to the emergency room. But I've seen some of our old senseis do stuff that's almost impossible to believe they did, and the student did well. So I wanted to learn more about that, but I couldn't.
That's Anthony Kamel right there. He will try and set a shoulder, and and I'm calling him out on it because.
Well, if the person's dislocated it before and they're an adult, there should be no problem. If it's a first time or a kid, it's a little different.
What do you call it? Getting back to and thank you for answering that question. But getting to like the person out there that would actually like to write a book on judo, whether it's regarding somebody that instructed them, or maybe a particular subject about within judo, whether it be technical or philosophical, how could you best guide them in doing that? Because I mean, for some people it's daunting. You said you talk it through, right? Do you talk it into your iPhone? Do you talk it into a recorder? Exactly what are you doing?
So it's my experience in writing stuff is in college. I had one introductory English class where I had to write one term paper. Other than that, I never wrote a paper. Because in a pre-medical education, you have a lot of multiple choice and some oral exams, and same thing in medical education. But I've written about half a dozen book chapters, and I've written several monographs, which are small books, 20 or 30,000 words on a subject. So how could you write a book? And so I'm someone who never wrote anything. Has no experience. I wasn't a kid who wrote in a journal, and but the way I do it is I write an outline. I get a piece of paper and I start everything with introduction and I end everything with conclusion. and then I write some stuff in it, and then I do nothing the rest of the day. And then I think about it for a day or two, and I go back and I revise it. And maybe I add something where I change the order. And then when I've got a pretty good outline, again, I think about it for a couple of days when I'm driving home and I'm listening to the radio. I think about, I think about what I was going to say today when I got interviewed by Ramon. And so then what I do is I get my recorder, and now it's on the iPhone. It used to be on the telephone, and I put it on and I say, my typist's name is Elaine, and I say, hey Elaine, I'm going to start with this. This is the first draft. It's going to be very rough. I want to talk about transgendered athletes. And introduction, transgendered athletes is a very controversial subject, period. It has lots of social and political overtones, period. The U.S. Olympic Committee recommended in 2015 and 2016 that each USA sport establish their own policy, period. Very few countries have established a policy other than Canada, period. Okay, that's enough, Elaine. I'll come back to it. And then I'll go first thing, definitions. And I'll start off and I'll say, Elaine, write down that we're going to make all the definitions in darker type. And first definition, trans. Trans is a word used in transgendered, transsexual individuals to explain the situation where someone has changed from one sex to the other. There are trans boys, there are trans girls, there are trans men, there are trans women, there are trans gentlemen, there are trans ladies. It's essential to understand all of the terminology to be able to speak about it. Then I go to the next thing. And so I do this and then I leave it alone for a couple of days. Then I go back and I sit down and I reread it. And as I read it, I say what's ever on my mind. So and what happens is at the end of but I have to be able to pay the typist. The typist costs me $2 a page, or $4 for a full page, $2 for a half page. So I have a business and they type normally in the business, but I wind up spending, maybe to do a book will cost about $2,000 at the end of the year in typing.
And typing.
Yeah, but I'll retype the same chapter 5 or 6 or 7 times.
Okay.
And,
to get it just right.
Well, each time I read it, I'll read it and I'll say, that doesn't sound good. I'll say, Elaine, change that. Change the he or change the that to he or she. And I'll just go through the whole thing. But then I'll give it to someone. I'll give it to, for instance, you could be an editor if you wanted. You could actually be an editor. You take the thing home and take a red pen and say, that sounds stupid. No, anybody could be an editor. And in fact, the book is targeted at judo players who need to know a little bit about medicine, or doctors who need to know a little bit about judo. So I've done very well in letting the senior judoka read it. And some of them have writing background, some don't. But I let some sections get read by children. To see what they thought, if they could understand it. And what I did is I took a lot of chapters and I gave different chapters to different people. So someone had an interest. So there's a bunch of physicians who are judo players, and if one of them was doing orthopedics, I said, can you read my knee chapter? I'm having a little trouble with ACL repairs, or there's been a change in hip replacements. I don't understand ceramic heads, because I'm a urologist. I'm not an orthopedic surgeon, but I would give it to them and let them read it, and they would say, no, that's pretty good. The hardest ones to read are those transgendered, abuse, psychology. I got, for instance, Corey Cuomo, who's our a clinical psychologist. He's one of our senseis.
Excellent.
He's helping me with the sports psychology section. What do I know about sports psychology? It's overwhelming. So he actually researched a few topics, gave me notes. So even though I'm the principal author of the book, I've got, in the acknowledgement you'll read, there's 20, 30, maybe 40 or 50 helpers. And some people wrote sections. And I looked for judo players who had some expertise in an area. That doesn't mean medical. Some of them are educational. Some of them are just experienced senseis.
And Corey's well versed in that area. What do you call it? Is there a section in the book for, like, let's say, legal concerns? Yeah,
so there is a medical legal section in the second edition.
Wow. Okay.
And the person who helped me with that is Todd Volan. Todd is
another excellent guy.
Todd is a attorney. He's actually a patent attorney, but he's a judoka, and he's a prolific writer and educator, and he's working on it right now for me. He's trying, and he said to me, "Well, what do you want me to do?" I said, "Just write me an outline, and then I'll make up my own story on it, and then you can correct it."
Yeah.
So I have many. I have about 20 guys like that, because how can I be an expert on everything? Sports medicine is a huge subject, and the only thing that I'm an expert at is the transition between judo and medicine.
Yeah, yeah.
I'm an expert at that communication or connection.
Do you know what else Todd is prolific at? Excellent. He is excellent at conversational Spanish.
Oh, yes.
I just want to throw that in there because I talk to him in Spanish all the time, and
So
have a ball
Todd,
with him.
with his patent attorney job, had to travel, and he said, "I'm going to South America a lot. I should learn Spanish."
Yeah.
So at 50 or 55 years of age, he became fluent in Spanish.
Yeah.
And it's very hard to pick up a language as an adult and do it fluently. And
He did well.
it just shows you some of the people we have. So we have these. We have amazing people in judo. We have amazing resources, and by capitalizing on them and making people aware of them, we can promote judo and advance judo. So one of the reasons for writing the book, I just thought of this, is one of the reasons for writing the book is that when the United States Olympic Committee says we need a policy on transgender athletes, let's base it on what USA Judo did, or let's base it upon what judo is doing. And if someone says, I need a better understanding of the medical legal aspects of running a judo tournament, they'll say, well, let's go to USA Judo's book, or let's go to USJF's book. But if we can establish judo as a credible sport, it's credible in the world, but more in the United States, then we can advance judo. It's a way for judo to become more popular.
That's great.
Yeah.
Cutting edge. That's what I want to be. This is an excellent talk, probably the best one I've had so far in my new Judo Waza podcast. Dr. Anthony Catanese, thank you very much. You know what, I do have one question concerning the COVID-19 virus. Obviously, we've seen a lot of dojos having to kind of scuttle their program. A lot of them are teaching online right now, like I am. I hate it. We got a lot of instructors, senseis that are getting ready to open their clubs back up. Some are doing it kind of prior to, the state allowance, of opening back up. And then some are just going to wait it out. For example, me, I'm going to wait till Governor Murphy says, hey, Ramon, it's okay to do it, knock yourself out. But in terms of any thoughts on that particular subject?
So there is a little bit worth saying, and some of this comes up with vaccines, a very political subject.
Vaccines.
Maybe I'm going to say a little something about it. There's a section in the book. There's a section on infectious diseases, and there's also a section on traveling.
Okay.
But in the world or in the United States, not everybody is convinced that vaccines are important. It looks like this COVID-19 virus is about 2 or 2.5 times the mortality or fatality, the chance of dying, of regular influenza. But
is that more?
About 2.5 times more than the flu.
Okay.
So if
that's bad.
Yeah, I don't know. We don't know what the exact number is. But there's a flu shot, and you can cut your chances of dying dramatically if you get the flu shot. Yet most people choose not to get the flu shot. So, like for instance, in our local hospital right now, we might have 12 people in the ICU with the COVID-19, but we might have 5 or 6 with influenza. Most of those people could have got protected if they got the flu shot. Sometimes it doesn't work, and sometimes you get a reaction to the shot. We know all those arguments, but if there's a vaccine for the COVID-19, it will be good.
Yeah.
We don't know what's going to happen with it. A lot of these respiratory viruses, some of them disappear and never come back. Some of them disappear with a change of weather. It may be some people think that the government has overreacted. We're in New York and New Jersey, and some people think that the governors have been too dramatic, but they've done it to protect lives. They've done it because they don't know.
I agree.
They criticize Anthony Fauci, and say, why is he coming up with such strict policy? And why is he changing his mind? And the answer is we don't know. It's new to us, but I think it's better to be a little on the safe side. I'm hoping that the virus is going to go away, or we're going to have a vaccine, or something's going to change and we get back to judo.
So you would get the vaccine.
I would get the vaccine.
Okay,
absolutely.
so I mean,
Absolutely.
I've said,
Yeah.
though I've been very iffy about getting the flu shot. I did get the flu shot this year.
Yeah.
Okay, my doctor pushed it on me. He pushed it on me, and so I did get it. But when it came to thinking about whether or not to get the the I don't want to call it coronavirus. I call it the COVID-19. Is it COVID-19 virus?
Yeah, same thing.
Okay, so
you're protecting the beer company.
I am, because I'm thinking of the economics. Viva Corona beer. But anyway, I think of as a judo instructor, I think I don't want to use it as like a selling point, but I did get the vaccine. I don't know if to try and calm the nerves of let's say parents that eventually in the future will be wanting to their child to do a martial art. I want to be able to say, oh yeah, I got tested, my antibodies came back negative, and that I got the vaccine.
So the value in getting a vaccine is that the people who are going to die of influenza, let's talk about influenza because we know more about that. The people who are going to die are elderly people with other medical conditions, pregnant women, infants. So if you don't get vaccinated, it's not going to hurt you. Your influenza is not going to hurt you or I. But if you infect your grandmother, you might kill your grandmother.
Yeah.
So we know how many people have died of the COVID-19 in nursing homes.
Wow.
If you could vaccinate enough of the population, and it's a little different for different viruses, but when you hit 60 or 70% of the population, you create herd immunity, which means there's not enough people to spread the virus. So if you have a room with 100 people and 70 of them are vaccinated, there's not a lot of spread. But if none of them are vaccinated, they'll all have it. So vaccination is a good thing. And yeah, there are people who get reactions to vaccines. Again, it's always political. Everything is political. But there are people who get reactions to vaccines. There are people who die from vaccines. But it's very rare. And you don't get autism from vaccines. That's nonsense.
Okay, so testing of vaccines has already started in the state of Washington, right? They're already testing a vaccine or vaccines with people because that's where the virus hit first, was in the state of Washington here in the United States. So with regards to us having a vaccine by January, do you think, obviously they're putting it to the front of the line.
So there's probably at least 15, if not more, different vaccines being tested, and it's unclear which one is going to be the one that works. They're probably all going to work partially or be short-term vaccines. In fact, it could be an odd situation where you need the vaccine twice a year or more often, and so we don't know what's going to be available, and there may be different ones available for healthcare workers, but vaccine is probably a good idea because this virus can kill people. Now, most of the people it kills are older, sicker, medical problems, pulmonary problems, smokers, overweight. But we've seen some young people die. And that's how influenza is too. Influenza can kill some young people. So you want to take it seriously, and hopefully we'll get back to judo. I mean, all of us are suffering from severe judo withdrawal. And there's only, the old guys where I'm part of, a lot of my judo friends are over 60, if not older, and they like Zoom workouts because they don't get hurt.
Yeah.
They get a little exercise, they get a little stretching, but it's not like really doing judo. So we need real judo.
The stretching is important for digestion, which will help out with sleep. So that's what I've been telling my guys. Well, listen, this has been a super informative talk. When can we expect the book to be released?
It's going to be. It should be the winter of 21. So it's
Awesome.
It takes a while. It's got to things go through slow proofreading and revisions. And,
And the editor of the book or the publisher is.
So it's a company called Wheatmark. It's in Arizona. It does educational. It's very easy to publish a book. And for instance, other people have used it. Mark Rosa used it to publish his book. Same company. So they're very receptive to it. And it's a very high quality publication. It's not. There are all sorts of publication companies. There are self publications, which you do it yourself. There are companies. This is a company that is a real publishing company, but it helps you do it. It helps you do it every step of the way. So
that's awesome.
Yeah.
I think I think every sensei should publish a book only because the notoriety you get from it is incredible, and if you do that within your own community where you're teaching judo, you know, it says a lot about you, you know.
I've had many senseis, and all of them had something, you know, exceptional to say, and they had wise sayings, and I wish some of them were written down. And if any senseis want to publish a book, I'll help you do it. But publishing a monograph is very easy to publish, something that's 20 pages or 30 pages. And what's very difficult are diagrams. Diagrams are difficult in books because it takes an artist. Yeah. It's hard to get it just right, and it's expensive to print graphics. Text is very cheap to print. Okay. But as soon as you start printing charts or photographs, and then every photograph needs a release. So I've learned a lot about the publishing business, but the publishing business is a viable business. If you imagine, let's say you were writing a novel and you get $1 royalty. If you sell 1 million copies, which lots of famous novelists do, you get $1 million. So you know, before there was internet, publishing was a very lucrative business. It's still a good business because people like to feel the book and hold the book.
I love to feel it. I'm reading a book right now, and reading a book, physical book, versus like a Kindle or iPad or reading on your iPhone, for me, it just you know, I prefer the experience. Yeah.
In fact, after this is over, I'm going to take you upstairs and I'm going to show you the book.
Awesome.
Because I have it in the pre-printed form.
Oh, that's awesome.
So what is it? I have 37 files with the current text and other notes and other additions, and then the reference materials in it.
Behind the scenes. I like it. Behind the scenes.
So when you write your book, you'll be ready.
There you go.
Yeah.
Oh, you asking this guy for help.
100 Judo Waza interviews.
There you go. Yeah. There you go. Well, listen.
Highlights.
The highlights, definitely. This will be one of them. Thank you, Dr. Catanese, for this interview. I'm going to try and get it uploaded tonight to share it with the world. If you haven't subscribed to the Judo Waza YouTube channel, please do so. Also, we have a very simple Facebook page. Like the page, and I'll be sharing this tonight. I want you to share with everybody. The more we share it, right, the wider net we cast and get the message out. So thank you again,
Great. Thank you. Thanks for coming.